Good evening, everyone. I'm here to welcome Michael Murphy and do an introduction for him on behalf of Dean El-Khoury. I am not Dean El-Khoury. We're often mistaken for one another. The dean is caught up in the presidential inauguration activities this week. There's a lot going on here at the university, and I want to welcome the live stream audience that's tuning in with us here. My name is Chuck Bohl. I'm a faculty member here at the School of Architecture. I direct our Master's in Real Estate Development and Urbanism. This is part of the Tecnoglass-lecture series. We thank them for their generous sponsorship. Coming up in this series, I'm to note that February 1st, this is Monday, we'll have Earl Jackson here for a presentation. And then on February 17th, Shohei Shigematsu of OMA will be here for a presentation. Michael Murphy is the executive director of Mass Design Group, an award-winning firm which he founded in 2010. Michael leads design and research programs at Mass and has overseen the expansion of Mass into 10 countries and 3 continents. Since its founding, Mass's international work has exemplified design thinking in its broadest sense, spanning the design of buildings, research, policy, education, and strategic planning. All projects are guided by the idea of low fab, locally fabricated. On every project, Mass Design highlights and scales local innovation and ideas, hires local labor, and uses local materials. They operate from a core set of principles that ensures they deliver sustainable and beautiful buildings while training a growing generation of designers and architects. The firm's ethos is captured in the phrase, building better buildings, investing in people that build them. Please welcome Michael Murphy.
Thanks. Thank you, Chuck. Thank you so much. I'm so happy to be here. Nice to be. I just flew from cold Michigan in a snowstorm, so this is a real treat. Can you guys hear me okay? Okay, I don't want to double feedback here. Thanks, I'm really excited to be here. I'm going to talk about our work, talk about kind of the philosophy of the work, and hopefully have a conversation afterwards with you all with some questions. At the foundation of Mass, I think is really a question of why become an architect. When I was finishing school, there was an article in the New York Times which came out, which fortunately it's a little bit later, but it said, want a job, go to college, and don't major in architecture, which was a really kind of looming, fearful sort of reality of our discipline and also our job market in 2012. What was later in that same article was that architects are more likely to be unemployed than English literature graduates. And what Chuck didn't say is I have a bachelor's in English literature and a master's in architecture. So, at the outset, I was pretty unemployable. So don't fret, students, you can get a job better than I can. But I think at the core of this, beyond being flip, is that there's a real, probably 2 realities. One, that there's a sort of value proposition challenge in architecture, especially in 2012, and I think continues to this day, at least we're coming out of that. And 2, we're so tied to the sort of engines of the economy. We're the first to go, or the engines of power, we might say. My pathway to architecture was maybe a little bit indirect. I remember it was my first semester of architecture school, and I got a call. I just finished my first final review. I had been up for a couple of days or whatever, and I walk out, and I had these phone messages from my mother on my voicemail, and it said your father had gone into septic shock, and he's being pulled to a hospital. He's in an ambulance. He had been suffering from cancer. And was quite horrific to hear that, especially after being up for 2 days worrying about how I would fit this random program of a gym and a pool into this configured space on the outskirts of Brookline in Massachusetts. And the kind of meaning of it all sort of was flashed in front of my face. And when I got to this hospital to see my dad, who had survived a surgery, I was brought into this very famous hospital. I won't say it's in New York City on the Upper East Side. And I was brought into this kind of plan, which I don't know if I really understood it then, but it's called a racetrack plan. Some people call it a dog trot plan. And you can see kind of patient rooms around the edge, interior corridor, nursing stations in the core, vertical circulation in the core. But it looked like this. And it was the holiday season. I was there with my family. We were some of the only people in the bed tower. And I just remember, and they told him he had to get exercise. He had to walk around that pathway about 4 times every couple of hours to get a little exercise, get his heart rate going. And this was the hallway he had to walk around. And he had to kind of drag an IV pole and bump into some of this equipment on the side that clearly is, we've designed the walls to keep equipment and these trays and things from bumping into them. And I just remember how undignified this whole experience was, how horrible that space is, and how this incredibly famous, respected hospital, which probably had great architects working on it, was so terribly designed. And in fact, design was not even part of really the equation. It was engineered. And I just remember thinking that day, what is it? What's gone wrong? What had kind of fallen through the cracks? What has this big system broken? Where the indignity of healthcare, the indignity of the experience of maybe an end-of-life experience could be so poorly designed. And as a young architect, I thought maybe one day I'll have the chance to think about the possibility of building a hospital, or maybe hospitals are this place to really test the limitations of what we can do as architects. This sort of value proposition came to me then, I think, and I was wrestling with it, of course, because we were being talked about. Buildings were being talked about as objects, as gherkins or as ribbons, or really kind of from the outside in. And this idea that buildings are objects and not experiences, I think, really potentially corrupts the way we can talk about what architecture can do, but also like the value proposition that we are, losing jobs from, losing economy from, losing identity from. Giancarlo De Carlo, one of the members of Team 10, wrote about this, of course, in the 70s at the sort of outskirts of postmodernism, at its outset, And he said, contemporary architecture tends to produce objects. He's talking about architecture in the 70s. I think he's talking about Leon Cryer, by the way. Contemporary architecture tends to produce objects, this sort of objectification of buildings, while its real role should be that of producing processes. This idea of process building is really interesting. But what's more interesting about this quote is he says that the distortion of doing so, objects versus processes, nouns versus verbs, may confine architecture to a very narrow strip of an entire spectrum. And what that may do, talking about architecture in a very narrow strip, leaves open the risks of dependency, he says, megalomania, and social and political indifference. I think that's a really profound idea, right? That what if we only focus on something very small about what architects do? It may lead to real social and political indifference. One may say we have gotten there, or had gotten there, at the outset of when I went to school in 2006. He called this a false dichotomy, that the choice between one or the other, between beauty or function, between an architecture of purpose and an architecture of form, or what we might say the social architect and the capital A architect, is being hypothesized now, that there is somehow a choice. And I think when you read De Carlo and you think about that, and when you think about, for me, the hospital, I realize that that's a false choice. It's a false dichotomy. They're not of the same system. We can't have ethical architecture and unethical architecture, or form-based architecture and non-form-based architecture that always are social and politically engaged. It's just a question of if we choose to acknowledge it or not. This came really to my face in a few days after, actually I had gone to the hospital, I went back to school, and I went to a lecture by this man. Actually, I had heard he was speaking at the same time. So just around the same area I went to the hospital, the same time in my life I went to the hospital. Dr. Paul Farmer is a doctor who works on medical facilities around the world, and in fact had built a number of medical facilities. And I heard him lecture about his work in Haiti, in Rwanda, in Malawi, in Russia, even in Boston. And he mentioned that he was building all these hospitals, and where are the architects? Why haven't any architects reached out to us to see how they can be of service? I have to build them myself. He kind of was asking, where are the architects of social justice? I thought that was really fascinating that the doctor would be talking about architecture and also mentioning why there was this sort of disconnect between our profession and our discipline and these folks in the world who need them most desperately. And he talked about this hospital of why architects are so necessary that he introduced in his lecture and then later in conversations, where there was a hospital in South Africa where patients got sicker because of a lack of design thinking or a lack of spatial planning. In this hospital in Tugela Ferry, South Africa, patients came in with one strand of tuberculosis, infected others, and left with another strand of tuberculosis, which this super strand eventually went on to kill them in a series of months, and everyone who contracted it died. And this super strand of tuberculosis, which is now called XDR-TB, extremely drug-resistant tuberculosis, has now become a kind of global pandemic. And while global health professionals are addressing this issue with drugs and more service, more doctors in more places, innovation, trying to address it from a kind of multi-pronged strategy, at the core, of course, is it's a spatial problem, right? The space itself had not been thought about for infection control. Simple spatial strategies could reduce infection rates by introducing more airflow. And that simple idea that somehow we had missed again to intervene, and that lack of intervention had actually caused significant impact on people's lives, had actually led to the incubation, cultivation, and death of people, I think was a real wake-up call that, to me, right, that architecture matters. Like, it really does matter. Design of space does matter. And there's real evidence, at least in the negative, of where a lack of it has had impact. So could the inverse also be true? If buildings are making us sick, could they also make us healthier? Became a kind of prompt through which a conversation with Dr. Farmer transpired into something bigger. A few months later, I actually ended up going to Rwanda to work with his organization. And he brought me to a district where they were talking about building a new hospital up in the north of the country. Kigali's in the center. They had been working in the southeast, and they had a new project that the Ministry of Health had asked them to work on in the north, on the border of Uganda. It's an amazing part of the country, incredible views, vistas, unbelievable volcanic range, the Virunga mountain range, and a huge dearth of professional services. Not just architects, professional doctors, of course, were missing in this state. In the country, there are about 6 architects working in total, so there's a huge dearth of professional services more generally, another reason why he was lacking that service. And when we got up there, he sort of asked about something differently. How do we make this building so it is actually being proactive? Right? How is helping to improve not only the basic services, but something bigger, something more holistic, right? Something about dignity. This was the space that we got to in that period of time. This is 2008. This was a military hill, and of course Rwanda at this point is 2008, so it's 14 years after the genocide in 1994. And with relative peace and stability at this point in time, the government had decided to transition this military hill to the Ministry of Health, to make it a hill for health, a hill for a hospital, and be a kind of beacon of hope instead of a beacon of defense. That, too, I think that engagement directly with the government was itself, I think, a clue into what's possible with the right team members coming together to build something more aspirational. And that's what this was for Dr. Farmer and his team, and I think it was certainly a wake-up call for how architecture can affect something bigger for me. In 2011, we opened the Batara Hospital. You can see that same hill, that same tree is on the left there. And this process of going through building this in this community, living on this hilltop, changed the way I think about the role of architecture. It changed me, of course, as a person, but I think I like to say it helped me unlearn what I had learned in order to rebuild an understanding of what buildings can do. I'm going to talk about that a little bit now. Simple things about spatial planning. If hallways are making people sicker, why not design a hospital without any hallways? Kind of simple idea that we would have exterior circulation in this kind of beautiful and temperate climate, but not easy with a Ministry of Health that has standards that you have to then kind of invert from a cruciform internal double-lidded corridor plan into one that has no interior corridors whatsoever. With the opportunity on this hilltop, we could really maximize the cross breeze and think about, let's say, spaces that were less infectious. For example, with people waiting in the outdoors, we have a better rate of infection control, of course. for some of the more risky spaces. But when we have riskier spaces like interior wards where we couldn't isolate patients, because data was showing that isolated rooms were killing more patients because there was less staff, right? The relationship between staff and isolated rooms is one that we often forget about in our designs, that we had to actually have open wards. So what could an open ward do if we were to get it to a place where we get around 12 or 13 air changes per hour? And that was possible. It's also not just about how it performs, let's say, in airflow. That's that diagram there, which we all love to use little arrows in our architecture diagrams. But more to the point, the simple skin system, the simple envelope system could allow for that airflow. I mean, the point being here that we didn't have money for mechanical systems, which we typically control. So unlearning the need to just introduce mechanical engineers and knowing that we didn't have the financing for that, knowing that we didn't have the mechanical engineers to maintain them, was also part of us thinking about a building that we anticipated might fail, something you might call resilient or something like that now today. But we anticipated epidemic outbreak. We anticipated failure. And so how would it be still functioning, even in the case of epidemic outbreak, is how we started to think about a building at this hilltop. The second thing about the ward, backing up a slide, is just about the patient configuration. We had been told that this is what the standard plan was that was causing a lot of this disease transfer, just a very open ward, very simple, uber flexible up on the left, and perimeter loaded, so beds are on the outside. But in reality, when I saw clinics in Rwanda and other places that had this plan, of course, that's not how they looked in reality. They had beds between beds. They had beds in the corridor between the doors. There was 2 people to a bed and 1 person under a bed. So the kind of super flexible had actually been abused, right? The design of that, the parameters assumed had not been respected, and so it had become an incredibly contagious and problematic space. And so a simple planimetric strategy of just introducing a fixed mid-height wall in the center, a little bit more of a fixed parameter, allowed us to control overflow and overbedding the ward a little bit more. The distance between the bed and the wall is really specifically engineered to not be able to fit a bed the other direction. We tried to affix cabinets to the wall itself so you couldn't put beds too closely together. That got VE'd out, unfortunately. And then a nursing station in the middle to sort of control the perspective around the ward, as well as make sure that it's not being overfilled. This was more of a patient-centered design, one might call it, or at least focused on what the patient's experience might be. The other benefit of this, of course, is that each patient gets a view of a window. And that perspective of isolation, that sense of isolation, even if we can't have direct isolation, was also based on metrics, based on data which showed that patients who have a view of a window get healthier. They get out of the hospital earlier. They take less pain medication. They have a better experience. Design matters. So those simple things, like kind of more rigid, a little bit more rigid, but not completely fixed, started to get me thinking about the role of architecture in shaping behavior. Of course, a building isn't just about how it performs and the behavior it shapes, but also about what it's made of and what it looks like. The choice that we had in front of us was, to choose materials, either, import them, like cement was mostly imported, or to choose locally. This local volcanic rock is found in abundance in that region. In fact, at that point in time was largely considered worthless stone. It was a nuisance underneath the topsoil for farmers, and they'd be farming their land and picking up this stone and throwing it on the side of the road and giving it away for free. You'd see it on garden walls, and some people would assemble it into more perimeter walls for their homes and their gardens. And this man is using that stone, but as you can see, the cement is literally proud of the stone. And I asked one of our colleagues from Rwanda, Christian Benimana, who leads our office there, why that was, and he said to me, well, this man is a wealthier man. Cement or mortar it's more expensive than stone itself. But we knew this was a beautiful stone. It was like a basalt stone. It was like a pumice stone. And we wanted to use it to wrap the whole building, especially the lower level of all of the lower buildings. So the building is sort of emerging out of the ground itself. And to do so, we had to work with masons who were used to building this and get them to build something that was more mortarless, let's say. Something that really revealed the materiality, tactility, the beauty of the stone itself. And we started on that corner, you can see what we call a ship's prow. And we started, and these masons got together, putting the stone together, cutting it by hand, and configuring it into a wall that we could see very little mortar whatsoever. And by the time they wrapped around the whole building, they were so good at putting the stone together. This one mason, Hakiza, asked if we could tear down the original wall and rebuild it with the new skill, which you can see here is quite amazing. The intricate kind of jigsaw puzzle design of putting each stone, cutting each stone together and putting it there, reminded me of something bigger, something more, kind of poetic, something more than just the functionality of a building makes a difference. It's really, the building represents something bigger than ourselves. This notion that architecture, even the decisions about aesthetics, right? Even the decision about what we make it, what we skin it with, can have significant impact. Again, change the way I understand and read a building more broadly, asking a deeper question, who built it, what hands touched it. I just want to play a quick video that is one of those masons, Anne-Marie, who really kind of exemplifies the potential of thinking about it that way.
There is one woman working in the masonry. They call that the same nickname. She's working in the masonry, which is normally not common for a woman working in the masonry. Now she's the team leader.
So as you can see, Anne-Marie is totally a transformative figure. Her work there has led to this whole female masonry movement in that area. And now women are actually walking from Uganda to work on continued projects that we've been working on there. It's a super powerful reminder to me that, she says, I never thought gender equity would be until I decided to become a mason, or that no value can be assigned to dignity. These kind of component pieces of architectural decisions, like what stone you choose to clad your building, have been lost. The kind of long trail of impact of our decisions as architects, as we source and spec, have somehow been lost. And this reminds me that we're very much in control of a deeper social and political impact on our world. So much so that in this process, the engineer that worked on this really kind of reinforced this. Bruce Nizet was the engineer who led construction, and he insisted that everything was excavated by hand. When a bulldozer was $10,000 a week in the capital, he insisted we bring in local people with hose and shovels and just excavate the hilltop by hand. And we did that in half the time and half the cost of that bulldozer. We focused on this idea of using as much labor as possible instead of as little labor as possible, as few people as possible. And I was reminded that this is a sort of not a new architectural idea. William Morris, even as the father of arts and crafts, was also, as you may know, the founder of the kind of Socialist Workers' Party as well in England at the time, was committed to investing in labor and using architecture and the craft of building to maximize labor. This notion that architects are making decisions which can impact communities and who builds, I think it's a really important one today as we think about questions of labor impact of buildings, or the sort of controversy around the Qatari Stadium, the World Cup Stadium, which, to Zaha's credit, has yet to be built, so she doesn't deserve all the blame, of 850 people already perishing in the construction of this World Cup campus. Just as a comparison, 28 people died on the Brooklyn Bridge construction. So this is a sort of epidemic of death, right? This is a horrific reality to great architecture. And I think, even though it's not her fault, I think her tone-deaf response is illustrative of the kind of disconnect we have as a discipline. It's not my duty, I have no power, I can't do anything about it. As someone who has really, especially for gender equity, been a trailblazer, this kind of powerlessness seems, let's say, misplaced. Her partner, I know, who spoke here as well, Mr. Schumacher, is less politic, of course. Stop political correctness. Architecture is only in charge of the form, not its content. Any architects that demonstrate a manifest tangible benefit to the poor is paralyzing to architects' creativity, arrests their ability to explore and experiment, as if the delivery of social justice is the architect's competency. The world that Mr. Schumacher projects is a scary one, and I think it's important that this argument was made at DiCarlo's time as well in the 70s, right? That this was the same argument that was being responded to, as if the pendulum can swing back and forth. Architects can be in control of the form, and then they're in control of some social movement. And I think now we can say that the pendulum really does not swing back, right? That there isn't really a choice. That there isn't a choice to decide. I mean, you either decide whether you engage in the political or social impacts of the building, or you don't. But there are social and political impacts of your buildings. It's a question of how we engage it and what value we pull from it. And this work in Rwanda really positions, but also reminds me that it's true. Even the decision of a stone can impact a community. And so too, the decision of where you build, who you choose to build with, and what you clad your building in has impact. So this conversation, even though there's an effort to polarize the debate, I think we will see, or I hope that we will see, that effort will only continue to devalue our discipline, and we must stop the fighting. This notion that the construction process itself, not just a building can be designed to improve health, but a process can be designed to improve health, was really evident in this project. And as we went forward, we got new projects on this hilltop, a new housing for doctors, where now that we completed the hospital, doctors were coming from the Brigham Hospital in Boston, as well as throughout Rwanda, to work on this site, this very rural area. So that 400,000 people and no doctors was radically changing. We now had 15 doctors working here, and they needed housing. So we were asked to build and design housing, and this we controlled. We did almost, as you might call it, a design-build effort, and we were able to choose the stone, the same masons, use compressed earth block from that very soil, from that very site. We were able to design all of the furniture ourselves with carpenters and put that carpentry shop on site, design all the doors and lamps and lighting, everything. Everything was made there. And I was reminded that this is possible. To complete the total design is possible. We can actually engage in that effort again as architects. And I know many of us try to do that in different ways, but the kind of siloization of our discipline into many, many different disciplines was sort of erased in this context. We kind of controlled more and more. We took on more and more risk, more and more liability, I guess, but there wasn't much liability because we were just responsible for completing the project as we saw fit. Hakiza, who was one of the masons I mentioned before, this is him on the Batara Hospital. And after this, he worked with us on the doctor's housing, and then he continued to use this masonry outside of even our work. And this is a house that he was building for a woman who saw a picture of our hospital in the Rwanda Air in-flight magazine and said, I want that stone wall on my house outside the capital. And so he was now, with his team, building that stone wall and a better version of that stone wall elsewhere. And this notion that not only who you choose affects the artisans you work with, but also that itself creates new value, and that value can then be sort of pushed back into the community, into society, where he's making that his own value proposition, remind me that these decisions matter even more. When I showed him this image, I said, can you get in the same position as you were like 5 years earlier? As you can see, a little before and after. And he said, oh, wow, the gaps between those stones really suck. So he's gotten much better. Yeah, so I mean, again, I think these kind of narratives are important for us to understand this deep, long trail of where buildings have impact. I think there's this other thing as well, which is, some might call it the sort of Gary effect or something. The buildings have this sort of this residual ripple effect on communities. Like they start to affect the building of other buildings. We were then asked to build a third building, a cancer center on this very hill, which opened 2 years later. And this is the first cancer center in all of Rwanda, the first outpatient cancer care in the whole country, one of the first in the region. And for me, whose father suffered from cancer, I'm sure for many of you who will face the same or have faced the same, this was very meaningful to work on something where I knew that nobody in this country had cancer care. Very few folks had cancer care at all, and whose parents were suffering from cancer, or family members were suffering from cancer, could not be treated. So this too became a kind of beacon of hope, and this hill continues to build. A fourth project, housing, that's just finished now for nurses, which we've just completed, and Marcella's here who worked on that. Very, very grateful for her work here. And this project we actually just completed this fall, so I'm just showing these first images. Again, continues to build. It's another lesson that hospitals themselves are sort of always under construction. When you look out, you see this other hill beyond this campus. That hill is now going to be a fifth project, which is a new university, which Dr. Farmer and his team has now raised money to build a second National University of Health. And so we're working on that project now, where hundreds of students will now be coming to this area, which had no doctors, no electricity, no core infrastructure, to now be kind of the central university campus in the country. And this is a sort of next project. I think the final kind of lesson I learned from this is that a building is a hypothesis, really, but how do we have that hypothesis affect bigger systemic impacts? Bigger things like policy, for example, to go back to that problem we were addressing at the outset, which is a national plan. The guideline itself was incorrect. It didn't think about infection control. It didn't deal with the patients in the context of that place. This double-loaded corridor was problematic, dangerous, potentially sickly. And so we were asked by the ministry to then work on a national guidelines and standards for the whole country. And this is both the guidelines, but also the kind of the way in which we organize the whole book, the whole standards, the whole kind of presentation to them. It's again about slightly more fixed parameters that can be adapted to site, any site, but also maintain their integrity and their adjacencies, so that you're getting kind of best-in-class healthcare. It can grow from 100 to 300 beds. It can expand longitudinally and also up a hill or across a flat site. And this building, which is now going to be starting construction in the spring, we hope, really showed us that an investment in this is always an investment in research, an investment in kind of rethinking the standards that we've been given, the assumptions that have been put in front of us. But if they lead to something like a systemic change, like policy change, I think the role of the architect, the agency of the architect, starts to emerge in a much more powerful way. Right? We start to affect social and political change in it throughout the whole building process, from furniture to policy. And that's what's exciting and I think also informative for me about working on this project and for our team. And from that, we really built a team. We were 5 people working when I was in graduate school until after I graduated and moved to Rwanda. It grew slowly. This is 2008. And in 2015, we're now in 12 countries, actually, and we're 55 now, 55 people, as this is outdated. Half our team in Kigali, half in Boston. And grown into to address, these are full-time people, these aren't volunteers, these are full-time staff. And to address this bigger demand that we saw was not only what Dr. Farmer was dealing with, a lack of services to fill his needs, his specific needs, which isn't just how do I get a building built, it's how do I get the right building built for this community and for the services that we're providing, which are holistic, but also that kind of demand more broadly in many other places. And I think we recognize that this is not just let's say, one building or even one policy is not going to change how the kind of bigger dearth of designers and the problems that will cause on this massive influx of population, especially around the continent of Africa, where we're going to see well over 1 billion new people in the next 40 years. And so we started to think, especially Christian Benimana, who leads our team there, started to think with us about how would we start to take some of these lessons and replicate them into a process or a model which could build another generation of high-impact designers that are bringing this kind of same level of intimacy to a project in many different places. So we started to look at the dearth of designers in Africa more generally. There's about a quarter of how many are in Italy alone. So there's a huge dearth of professional services, professional schools, architecture schools, engineering schools, and this massive, massive building boom, which will be coming in about 15 years, where cities that we haven't even thought about are going to be built, huge amounts of housing, hospitals, educational infrastructure. I mean, what we saw in China over the last 15 years, we're going to be seeing twice that in Africa in the next 20 years, and all of us will be working there to some degree. And I think getting ahead of that and understanding how we start to address what we also see are the negatives, which are public health issues, issues of labor abuse, a lack of design thinking, a lack of strategy, a lack of intimacy and empathy. We went about trying to think about what would we need to do, and so Christian proposed starting a school of architecture to train the next generation of African architects in particular, but really being a kind of Bauhaus kind of center, a lab where have an international presence, and so this is a project that we're working on that we will launch the first class of this year. And the sort of African Design Center will be trying to replicate and test some of these models that we've learned in working there, but also challenge what we've learned, challenge our hypotheses, change in scale, work in different program, and really investigate a sort of multidisciplinary approach to how architecture can affect change and improve lives. I want to talk about a few other projects because some of the reasons, some of the defense of doing this came out of bringing on fellows. Some of the first graduates of the first School of Architecture in Rwanda, which opened in 2010, came and joined our team, and then those fellows went on to lead projects that we got across the subcontinent in particular. And this project in Malawi was one of those. This was another great example of what's going right and wrong with government ministries of health. The Ministry of Health in Malawi had committed to addressing their really, really terrible rates of maternal and infant death, one of the highest in the world. And one of the reasons for that is mothers dying in childbirth is because they didn't have access to care, weren't located closely to medical facilities for emergency care. There was a lack of service in the hinterland. And to address that, the concept was to bring women to the hospital early, creating these birthing centers, these maternal waiting homes that would attract women to come anywhere from 1 to 4 weeks ahead of time, be at the hospital in case of emergency or challenges, and ensure a safer birth for mother and child. But of course, that's not simply a building problem. It's really an ecosystem problem. The ministry, reached out to, they have 1 or 2 architects that work in the ministry itself and oversee, literally hundreds of buildings. And the prototype that was offered to them was something like this, something that's very familiar to me, right? A double-loaded corridor, actually half-height walls. We might call it a cattle barn, something really, incredibly depressing, but also problematic. No airflow, no light. It's so bad that the women didn't even want to go into the building. They were sleeping outdoors. Not to mention these 36 beds barely met the needs of the 300 people that would come to the hospital, women and their family members to accompany them for the weeks on end. They had to be there outside of work, waiting for medical care or a baby to come. And so this is a design problem, right? This is a problem of not only what the building is, but how we design that whole process from, let's say, getting told that it's best to come to the hospital ahead of time to actually having the baby a couple weeks later. And we realized that the building, at least as an architect, everything's a nail here, as a hammer, everything's a nail, that we start with the building. But we realized we could do something better with the basic shed framework. We could break it up to create independent units, introduce airflow, introduce light. We could link roofs to allow for overhangs, generous overhangs where people could sleep, even though we couldn't have beds for those over 250 other people who were there. We could at least accommodate them in the case of rain. And then also dealing with where it's located, building a kind of prototype that would be accommodate change or accommodate site climate conditions and location. And then, of course, each one having their own wet core, their bathroom and washing and showers with some perimeter for security. This, let's say, cluster strategy allows for growth from 36 to 48 or to more. It allows for each hospital in the country, all 150 of them, to take this or some version of this and accommodate it to site with the basic parameters in place. It allows for interstitial space to build community, to allow for jobs and education and training, as well as just places to sit in the hot sun and be cool. And then the constructability is one we also wanted to, let's say, not just modulate, but think about how it can be accommodate or acclimate to different conditions that we couldn't control. This simple engaged, no pun intended, engaged column, would could allow for a lot of different things, a lot of different beds or shelving or sort of long benches for people to sleep on. And you can see that here, where these columns would allow for these different interstitial spaces underneath these overhangs. We're excited we just opened this a few months ago, and already, as you can see, hundreds of women are there, using it as it's intended to be used. When John Paul Sebayahi, who led the construction and was one of our Rwandese fellows and moved there and led this construction, and he just was like, I get it, I understand why I'm here. All of these women are sleeping outdoors. I mean, they're sleeping outdoors, they're waiting to have their babies. It's this terribly undignified space. It's horrible. How can, this simple strategy could greatly improve their experience in their lives. And I think what's really interesting about it is there is actually metrics. We have a baseline, and then we have this new prototype, very cheaply built. Those are compressed earth blocks, unreinforced, that we could have data which shows not only reduction in maternal and infant death, but also the increase in demand and desire for women to come to the hospital. Another couple of fellows also worked on a second project which we finished recently, the Elima Primary School. This project is in the middle of the Congolese jungle, and the kind of question that was brought to us was, how can we build something that will radically reduce the killing of wildlife, the killing for bushmeat of bonobo monkeys in particular, but the conservation of wildlife is something that large nonprofits like African Wildlife Foundation are focused on, and they realized that just simple educational strategies alone were not doing it. They needed to build infrastructure. So Andrew Brose, one of our project managers there, who actually grew up in Burundi and Kenya, and Jonathan Bongi and Janse Mulela, who are both Congolese graduates of the architecture school there, joined Andrew, and they moved to central Congo in the Equator province. 3 flights and a 6-hour motorcycle drive. It took days to get there, and they lived there for the next year, constructing this building by hand. Every material, this is sort of the extreme version of how we make things by hand, and how we could make things by hand, how we could take that concept of local fabrication or low fab even further. And here you can see mud construction, timber construction, hand cut by felled trees that were within a mile radius. And then we chose the roof, what materials we choose and how they perform and their length of time, their cost, and the labor that is required to make them, and their replicability, their maintenance. Starting to create a matrix of decision making to allow for an understanding of impact. Got us to a place where I proposed using shingles, actually something that hadn't been used in that area before. But the metal roofs were rusting and then being patched up by palm fronds. So we thought this could be more sustainable, more replicable, more repairable, and something that could maybe kind of encourage or catalyze a new economy like we saw with the stones. And so here we have a shingled roof, open classroom that is open classroom school, which really is more of a community center. As you can see, 600 students are coming here. It's the first major piece of infrastructure in this entire region. And it's just been a super powerful project to think about, again, this kind of going into a place, living there, working on this every single day, coming out with this building, handmade, really a handmade building. And super, super proud of this project, and really excited about its completion. It just opened in October, actually. This concept that we can affect, let's say, labor and material choice and this broader residual impact, I think, is challenged, of course, outside of the rural area when we think about the urban area or the urban condition, and starting to address those bigger, let's say, public health or public impacts that buildings participate in. Often we forget about how they participate, but they do participate in that relationship. And we had to address, and we were asked to address this very issue in Port-au-Prince, Haiti, where, as you know, the earthquake happened in 2011. I was in an airport in Brussels when I got the email from one of our Partners in Health colleagues about this horrific earthquake. And we like to remind people that an earthquake didn't kill 250,000 people. It was buildings that fell on people after an earthquake. It was this sort of failure of our built world, the kind of structural violence of the built world, which was what killed people. And the kind of not just functionality, lack of safety. And what was terrifying is our culpability in that, and also the question of what can we do? Not just how do we build back better, a question that Dr. Farmer and others asked, but what do we build and what went wrong in the original building? As many architecture studios, I'm sure some here, and although I'm sure you guys worked in Haiti and many others around the globe really started to acknowledge that we had to do something. And many studios showed up to do something. Of course, this other outbreak happened, which is cholera. And cholera is a disease, it's airborne disease, it's a disease of infected water, bacteria in the water from human waste. And the collection of waste-infected water with this bacteria caused the largest epidemic of cholera we'd seen in the last century. Cholera used to destroy our cities through the 19th century until we realized that it was the intersection of human waste and water and drinking water. And we changed our cities. We designed our communities around the separation of the two. But in Haiti and Port-au-Prince, so much had gone wrong in the built environment that when the place was on its back, in the most vulnerable condition, the diseases of the built environment reemerged, right? The disease of cholera, it's really a disease of the built environment reemerged. Cholera tents popped up throughout. Emergency groups came, of course, they were already there, put up cholera tents throughout definitely the capital city, but throughout the country, and really stemmed the epidemic, so did good work. But of course, the endemic problem that cholera would remain in the water table, as well as the fact that to stop the next epidemic, the only hypothesis or proposal was for large underground piped wastewater infrastructure, was also unreasonable and unbuildable. And so this interaction of the emergency and the long term, the short term and the long term, let's say the development agenda of response and the long-term strategies of public health came together on this disease, and the built environment, or architects, really, I think, are questioned to be, what's their role in that? An organization that provides the most healthcare in downtown Port-au-Prince reached out to us to address this and wanted to build the first permanent cholera treatment center. And so our question, much like in Rwanda, where if you could build a building that makes people healthier, what would it look like? So too here, except instead of airborne disease, we had to deal with waterborne disease. So the very simple strategy was, instead of relying on a failure of a piped water infrastructure system around the facility, we could instead decontaminate the waste on site. A very simple idea, again, but why not collect the water, collect the waste, and decontaminate it locally? I don't know why that happened. This simple idea led to this cholera treatment center, and I'm going to show you that. I don't know why the program crashed. And we opened this in April. And we're already seeing amazing results. You're seeing cholera patients from around, not just Port-au-Prince, but around the country come to get service here. And different metrics that we could apply, not just people that are healing from cholera, but cholera is really the tip of an iceberg of a bigger issue, which is diarrheal disease. Diarrheal disease is the #1 killer of children under 5 in Haiti anyway, before cholera, but is also indicative of the kind of diseases that we'll see in other rapidly urbanizing settings around the world. And the notion that a building could start to address, even represent the goal to address this broader failure of the system beneath the topsoil became, for us, really the point of this project. It can address the very specific needs of those patients, but it also should represent the demand for better wastewater infrastructure more broadly in the city at large. And this is evident by really this image, this aerial, where the cholera center you can see here, it sits on this main boulevard, Boulevard Harry Truman. And Boulevard Harry Truman, of course named after our president, was built in the late 40s on the 200th anniversary of Haiti's independence. And it was built on the water's edge, right? It was built as a promenade on the ocean's edge. Right, so the city that grows beyond it, Army Corps of Engineers built it. Army Corps of Engineers built this big canal that brings all of the waste and detritus down from the mountains, and that fill beyond is now, the future of the city. The formal here, the informal here, the rapidly urbanizing and growing on the right, the fixed and constrained on the left. And where we had sort of developed strategies to solve cholera in our cities in the 19th century, it's a different problem now. It's a different urbanization. It's a different investment of infrastructure. And we have to find new ways to solve these 19th century diseases with 21st century strategies. Dr. Bill Popp, who leads JESCIO, which is the organization's hospital that it is one of these visionary leaders, and really Caribbean. The metal work kind of is the sort of exoskeleton, of course, of the tap-taps around town. But this very kind of colorful and beautiful and ornate, again, intimate work was super inspiring to us, and we thought about how it could actually, what we could invest in the process of skinning this building. Some people on our team have been doing research on high-performance skin systems at the Graduate School of Design at Harvard, had developed this robotic strategy and this robotic arm to develop highly customized perforations and apertures to allow for different conditions inside, light, air, privacy. And so using that as the initial strategy and some of that testing, we thought, how do we make this by hand? How do we introduce that with Mackenzie Ville, who ran a metal shop around the corner from Jessica's campus, one of the more famous ones, and we worked together to redesign that, and so it could be hand cut or handmade. Simple jigs with different simple angles and hand cut panels allow for this highly customized skin system, which introduces the performance needed in kind of our modern thinking about how we bring, kind of a maker sensibility to a building, but also done with the resources we had locally. This idea of low fab or locally fabricated is not just about, it's not just anti-prefab, right? But it does reveal that in the love of prefab we have in this country, we've forgotten that the variable of labor has been kind of suppressed, right? Prefabrication works here because materials expensive, labor is expensive, materials cheap. But in Haiti or in other places where we had been working, labor, of course, is very cheap and material is expensive. So why are we deploying that same strategy on these economies where actually it's the inverse that we want, more jobs and more things that are customized. Low fab to us is more than just a movement for Haiti or Port-au-Prince, right? Or for Rwanda, it's a movement here in the US as well. It's about thinking about what resources we have available around us and designing ways to leverage them in the best possible way. The choices of what we use to build and who we choose to build are also as important about where we choose to place the building as well, like how we understand where it should be. And I think understanding that condition, or at least asking that question, is really one of social justice. It's really one of equity in our community, something that we're all coping with in the US, this question of where buildings are and how they perform and who they're serving. And when I'm in Port-au-Prince or when I'm in Rwanda, I'm often thinking about my own hometown, which is in upstate New York, Poughkeepsie, New York, which I don't know if any of you know, but it's like this beat-up city on the Hudson River that has this terrible economic decline that's happened for 30 years, and sort of like people call it the Detroit of upstate New York. And I was reminded of all of the challenges that we're seeing in these vulnerable cities. The most vulnerable are bearing the largest burden in the face of disaster, in the face of change, and our, let's say, agenda of where we as architects can apply our resources or think about its application should certainly be in the places where we see vulnerability or where we see real need or the demand for services that could address bigger systemic, holistic problems. And so when Poughkeepsie got hit by Hurricane Irene and flooded the downtown of the city, I was reminded of Port-au-Prince. I was reminded of our work elsewhere, and I thought, what could we as an architecture firm do, even in my hometown? The creek that runs through the center of the city flooded, in particular, down to the Hudson there. And this center, this old school, where actually my father had gone to Poughkeepsie High School here, had recently, or let's say in the last 2 decades, turned into a social service center, what's now like the program of a hybrid nonprofit center. It had every nonprofit in the city in it. It had a food pantry, it had Planned Parenthood, it had homeless shelter for the day, it had after-school programs, it had this range of social services, and it had been hit very hard by this flooding. They reached out to us, this man, Brian Doyle, reached out to me and said, I've seen your work globally, how can you come and help us in the city? And it kind of brought us together to think about the same strategies, not just about how you fix a building, but what that building might do to catalyze change in the community itself. This is that river, and we had been, actually a program at Columbia School of Architecture had been working on Poughkeepsie a couple of years prior and had developed a very creative and thoughtful pop-up park strategy along the creek, which we encountered and found and reached out to them to reuse and think about as a strategy to begin consideration of how to think about that one building. Because that one building, the Partnership Center, actually sat on that pop-up park necklace strategy. It sat right on that creek. And so it could be maybe the catalyst for turning the city into investing in that new core infrastructure, again, turning it from a liability to an asset. Lots of hard surface, kind of vestiges of urban renewal run through the entire community and through the entire city. It gutted downtown. But through simple design strategies like rethinking it into soft surface, introducing slightly new programs that were more public, addressing the facade again and giving it a new identity, simple things like painting it. We looked at old pictures and found that it used to be gabled, and they had taken that down apparently in the 50s for upgrades in engineering and mechanical systems, and reintroducing that as a kind of urban food program. Just simple images, renderings alone. Of course, we haven't built this yet, but renderings alone mean something, actually. Envisioning services that we do means something. They can have impact. I was able to go back to my hometown. I've been living in Boston now for almost a decade. Go back to my hometown and present this. And then by presenting this, this entire community came out to see it. We had like 300 people there. All these folks came up and said, I used to know your dad, I knew your mom. And it was very sweet. And then presenting this vision for the city, and people had kind of given up on the city. And it was super powerful. And it was powerful for me personally, obviously, but it also was powerful in that it mobilized a conversation around what else this sad old infrastructure where poor people go to get basic services, but nobody wants to go, could actually be. Could it be an amenity and not an eyesore? And what would it mean if it was amenity for the city? How could it catalyze change more broadly? At that meeting, I met a very visionary young woman who had left Vassar College, which is in Poughkeepsie, but hadn't invested heavily in the city in years, and had joined a local community development corporation, a CDC, and they had been working on low-income and affordable housing throughout the city, homeless shelters, serving this community. And she said, I have this vision that we've been working on to revitalize Main Street, downtown. All of Main Street, as you can see in the blue, empty storefronts, just riddle the whole thing. And we have this vision to invest in the center of the city instead of at the river and really catalyze change, and we want you to help us. And they had started with this old factory, which when I was growing up there, looked like this, and has now been redesigned into an urban food program, a new cafe and a roaster. They've gotten statewide development grants to turn this, it's an old underwear factory, into this hub of change. And they had this vision of an innovation district, but they didn't have the resources. They didn't have many other people paying attention. And we started a conversation about what else we could do, who else we could bring to the table, what else could we do for this place? Could we bring in both outside money and as well as inspire hope and dignity in the community that had been suffering through economic decline for decades? And it was related to the Family Partnership Center, but additional, bigger, kind of more aspirational. And with that, we started to think about other cities that had done the same. Worcester, Mass. Looked like Poughkeepsie and now is going through this incredible revitalization. And a lot of it's been about investing in the colleges and making the colleges who are there to put money and time and students on the street. There's 8 colleges in Worcester. There's 5 colleges in Poughkeepsie. People like Theaster Gates have done amazing work in Chicago, Southside Chicago, where I went to school and lived among the South Side there, and have seen radical change even just by investing in arts and cultural programs in the South Side, by paying attention, by just investing in where he wanted to spend his resources, his time, bring his community together, create happenings. It's catalyzed change, it's catalyzed a national conversation, and it's brought people to rethink and reconsider their perceptions of value. This is an example from Cleveland, where actually 2 friends of mine have totally developed a whole new neighborhood they call Hingetown, in a place where it wasn't a neighborhood 5 years ago, just by buying a building and investing resources there. And so our concept in Poughkeepsie is this new Center for Entrepreneurship and Design that we will be working on downtown in the city over the next couple of years. And we're excited we've gotten a grant to send a fellow who's living there full-time, and starting this conversation, this bigger vision to kind of catalyze change locally through incremental shifts. We've seen it globally. We can see it in our own backyards as well. And so I think, for all of you and for those out there on live streaming and things who ask, what can we do as architects? How do we jumpstart our careers? How do we get involved in projects? Those are very neighborhoods that we come from, where we can have a big impact because we have such a personal relationship to those places. We're so immersed. So I want to just talk about one more project, and I'm going to ask you all who, I don't know if anyone's tweeting or anything, but to not do social media for this part of the presentation. It's our last project I want to talk about. And thank you for respecting that. Very happy to talk to you all. I welcome questions. Thanks. Chuck, I don't know, how long do we have time for questions?
Time for a couple of questions.
Oh, there's a microphone, I think.
Thank you for your words. Your projects are really inspiring. I had a question regarding your project in Haiti. Mm-hmm. When you were mentioning the contamination of the water, what were some methods or strategies that you used, and how did they affect your architecture of the building? Or
yeah, it's a very simple anaerobic biodigester system. Typical anaerobic biodigesters have like 3 chambers. To address cholera, we worked with some civil engineers and thought about a 5-chamber anaerobic biodigester, which is just bringing the waste, collecting it from the very building, and putting it into those chambers as it settles out along 5 chambers. And then the last chamber, introducing chlorine to actually kill any of the remaining bacteria that may have emerged from that process. Challenges there, of course, it's sometimes below the water table, or so we had to actually build new ground soil to bring it up a level. The building was lifted up. So it was on top of those tanks, but the building also collects water because it's a very wet building, so we're constantly cleaning it. So there's large tanks underneath as well for rainwater collection. Other questions?
Thank you so much. I was wondering, with your business model, what makes it so successful as compared to other business models out there, like Architecture for Humanity, which has recently closed? What has kept your drive, and how has it become so successful?
Well, thank you for saying it's successful. It's always a struggle to keep an architecture firm afloat. We have a mix of both revenue and donation, so we're about 50% revenue through projects and 50% funded through grants and donations. One of the things about our model is we have a research team. We have 7 full-time researchers on team looking at these issues that I'm talking about, both material research as well as these harder and deeper questions like, could a building reduce maternal and infant mortality, and what would that look like? We have partnered with other grant-making organizations, Robert Wood Johnson Foundation, notably the Atlantic Bechtel Foundation, and Ariadne Labs, a Boston-based research organization, to ask these hard questions. How do we design buildings and spaces that affect health outcomes, and what could we focus on? So that's sort of targeted multi-year research initiatives that are looking at kind of objective questions for peer-reviewed journals and things like that. So that helps also a revenue stream to keep those folks paid. I think the question about AFH and others is the one piece of advice I would give to those who might be interested in work, especially on small-scale projects like this, is the curse of the small-scale project. There are these schools and community centers, these low-cost, basic, what I might call primary infrastructure projects that are needed globally. I think we've estimated 1 million new primary schools need to be built in the next 5 years in Africa. I mean, just insane amount of construction and a huge opportunity and need for design. The problem, as an architect would tell you, is that they're very small, so the margins for fees are basically, we'd never afford to pay for an architect. And they're highly leveraged, right? So if they go over budget, you as the architect, if you're participating in the building, if you're constructing it, are are basically left very vulnerable. So I think one of the challenges that many folks in the public interest design movement face is over-leveraging themselves in construction projects that have low fees and long, and really short timelines, right? And so if they go over by a month or 2 months or 6 months, it starts to radically increase the cost of that design service exponentially and starts to become a real problem. So our challenge in the kind of space that I think you're referring to, but I think more broadly as a discipline, is to see how we bring principles like this into the market more broadly at bigger scale projects that are outside of just the small scale intervention. And that's where we've really invested time and resources, and we're working on projects that are north of $10 million, north of $15 million. So that starts to become affordable for architects and should pay for design services.
As a follow-up to that, if that's okay. You mentioned starting out in your local area. What advice would you give to someone just starting out who wants to make a difference locally in their area, and some things that you would, like problems you have faced in the past?
Well, there's loads of folks in each of your communities that are doing incredible work for folks that live there. And I think as a designer, there's a lot you can offer, but it's really the conversation and the relationship is the first thing to build. Obviously, sometimes the design project is not evident. In fact, I often say that if you need an architect, you're often too late for an architect. Once they've decided that we need a building to solve this problem, there's a good chance that the problem hasn't been well articulated. So it's getting in early, actually, and building that relationship to understand if a building is the right solution to the problem at hand. And that only comes through engagement and trust and relationship. So again, why going back to your home, I don't know if you're from Florida or from elsewhere, going back to Poughkeepsie, I had those relationships. They trusted me. They could ask this question really openly, and it has fostered and is continuing to foster a number of conversations that I think will turn into great projects. We have yet to be paid. We haven't made any money. We haven't made any revenue. We haven't supported that investment. It's all been pro bono to date. But we're convinced that the commitment there will actually create projects will eventually support a long-term investment and change the city. So for us, it's worth it. But it takes time, it takes resources, and it takes a lot of patience.
Thank you.
Anyone else?
Thank you. Thank you for a really interesting talk. I have a question that goes back to one of the first things you said. You talked about having to unlearn what you learned in architecture school. So I'm a little curious about what you would do to essentially change architectural pedagogy as it stands now, or what you would recommend students study who are in existing schools right now.
Yeah, I mean, I'm also teaching at the GSD, so you keep it by. I don't mean to, I certainly don't mean to attack architectural pedagogy. I think there's a lot that, I think a lot of what's happening is incredibly powerful and is a unique way of thinking that is unlike anything else, and so I wouldn't change any of that. I think what I learned so much about was the field-based learning, like getting in and trying to figure out how to put things together was super informative to me. And I know there's a debate in the academy between design build programs and just academic programs, but at least for me, I'm the kind of student that really learned a lot about getting there and trying to figure out how to put something together. And in particular, having to put something together in a resource-poor setting, where you couldn't, I want to spec, a metal skin system. You just couldn't do it. You couldn't spec it from Nairobi. I couldn't spec it from Kampala. We had to spec it from China or Dubai. And so it wasn't really an option. It was even hard to get concrete. So what I learned over there is that resource limitation creates resourcefulness. And that resourcefulness is actually something that I think I hadn't really been taught about in my years of design, where I'm really trying to think about how a form makes sense and to anchor it with integrity and to really develop it well. And to work with really challenging programs, which are hard to build, of course. So the second part of your question, what kind of pedagogical shifts would you make? I mean, our program, our school in Africa is really a field-based, what I call a residency program. It's thinking about what the global health doctors that I met have done, which they've go and spend a year living in Rwanda. They're surgeons in the Brigham in Boston at Harvard, and they go and spend a year training in challenging places to learn medicine differently through the eyes of others that don't have the resources they have in the hospitals in the US. And so I actually think there's similar benefits for architects. Simultaneously, there's, of course, a huge amount that I learned just by working with Bruce Nazay, who was the local engineer that had taught me so much about how to build differently. And I think the fundamental thing I learned is that every decision can be intentional. And that I don't necessarily think was taught to me in any deliberate way, or maybe I wasn't listening,
Hi, I have a question which has to do with the way in which you transpose some of the experiences that you had in Africa to a North American context, or what you might describe as advanced economies, because the ability to make a significant difference through, I think you call it primary infrastructure, in which modes of fabrication and making are able to, they're operating in a different, let's say, as I guess you might call them, stage in industrial economy or building economies.
Say the last part, staged what?
Stage in the development of building economies, that you can still, as you described, the typical inversion of cost of labor versus cost of materials is effective in Africa. But when you come back to the States, a lot of the projects that might try to utilize similar strategies would tend to be they would be boutique projects with small impacts, rather than the projects that you did in Africa, which seem to be small projects with very big impacts. Maybe I'm wrong about that attribution of impact, and you can tell me. I'm happy to hear that I am, but I'm just curious, because in some ways, the overwhelming character of organized manufacturing of spec building parts and the modes of mediating labor are so different and developed in the U.S. I just wonder how some of those experiences are translatable.
Yeah, no, it's a great question, and I think it's true that it's not necessarily one-to-one, right? We have to, and it wasn't one-to-one. My experience from Rwanda to Haiti, nor was it one-to-one in Haiti going to now Liberia, where we're working post-Ebola. But it certainly isn't one-to-one going back to Poughkeepsie or Montgomery. That being said, so we have to, the answer to that is, I think we have to, it's contextual and it's site-specific, right? What are the labor and material conditions of that place? And how do we answer that question locally is actually the question. And just going through the exercise of asking that question is itself illustrative of trying to affect the building process differently. I don't think it's possible to totally reform everything overnight, but I am convinced that this is the first step in, let's say, a 10-year, 15-year project, which we start to make evident what I call the human handprint of the built environment more regularly. And I'm convinced it's possible because I think we just did it with the environmental footprint. It was a 20-year project or more, that people were talking about what's the environmental footprint of a building, and we need to focus on this. But, the shift that happened in the last decade and a half, where now everyone asks, well, is it sustainable? Even if they don't even know what that means, is a paradigm shift in the way in which we think about a building and its relationship to place, right? That architecture has some, even in the ether, the market, the public, my mother recognizes, who doesn't know anything about architecture, recognizes that a building has some relationship to the environment, and have you thought about it, is the first question. So that sea change was significant. It took a long time. It took a lot of people focused on it, but it eventually did happen. And I think so too, the next evolution of that, and I'm not the only one to say this, is that what's been great about environmental sustainability, the conversation around environmental footprint, it's been successful both in the market as well as in kind of ethical discussion and consciousness, but it has left out the conversation of human capital. And most people are very critical of that, that we are not talking in a comprehensive, sophisticated way about the human capital component of the sustainability of this conversation. So how do we evolve that? Well, I think it's about, I've learned at least through thinking the building process as an opportunity and not as a liability. And I think that simple idea, again, is not mine alone, but is applicable to the US. In fact, there are examples of it already happening. I read about, during the financial downturn, this is 2011, so we're still reeling from this. A guy in Idaho, a local contractor, just said, I'm not going to buy anything from Home Depot. I'm just going to only hire and go to the local hardware store. I'm only going to employ folks who are out of work in my community, and we're going to build this few projects I have just with those folks that I know and need jobs, and I'm going to spend my money at the local hardware store. I mean, that simple decision about a building, it's an economic decision. It may cost a little more, but it's an ethical decision. It talks about long-term value, and I think it's related to this in a smaller scale. So I do think it's possible, but I think we need, as you say, you could call it boutique, but you need what I might call exemplary projects, which articulate the whole process. So part of the reason I talk about people in my presentation is because I think actually we talk about architecture wrong. We talk about it as an image and a plan, but we actually talk about it as a holistic system. We have to talk about who built it. We have to talk about how it's made. We have to talk about it as a case. And so it's both an argument towards the discussion around what architecture, how it's discussed, but also how we manifest it in the world and what we expect from it is, I think that there's, through labor, there's this missing thing. And if we talk about labor again, we start to actualize our built environment differently, and we become empowered, I think.
I think that's a great note to end on, and I want to thank everyone for coming out, and I want to thank Mike for an inspiring lecture tonight.
Thanks very much, everybody. Thank you so much.